Hello, everyone. Welcome to the first webinar from Engage. This webinar is the first of a series that will include an overview of what Engage does and how we're partnering with emergency nurses, and followed by topics that are related to a healthy work environment and how to make an impact for your team. My name is Jen Schmitz. I am the Vice President for Client Engagement with Engage, and I'm joined today by two of my colleagues, Andrew Slifko and Rachel Wood, both of whom are client engagement leads. Engage, powered by ENA, has a bold purpose. Our goal is to elevate emergency nursing excellence through both healthy and safe workplaces. Engage was created based out of a need seen and noticed by emergency nurses and communicated by nurses at the bedside that there needed to be actions and improvements in the work environment. So as a result, Engage was created to be able to partner with departments, to be able to make an impact and improve the experience for nurses every day. As we go through the webinar, we would appreciate any questions and we want to hear from you. So please enter them in the Q&A folder and we will answer them at the end. Our vision and commitment. So Engage is grounded in expertise, specifically emergency nursing expertise. All of our team has experience in emergency departments, both as a staff nurse or as a leader, educator, and other roles, but truly you are getting an experienced emergency nursing team that will partner with you. That partnership leads to our co-created solutions. Our belief is that we are here to help the department with whatever specific needs they have, and really look to do that with the team overall. So we don't want to hand them a solution. We want this to be a partnership where we are helping you with your goals and getting you to success. We are committed to emergency nursing. So part of ENA and Engage's mission is to advance emergency nursing excellence. By creating and supporting a healthy work environment, we are doing just that. And so all of our work really is tailored to this environment and how we can help support nurses in this area. And lastly, healthy and safe workplaces. This is the focus of what we do. There are 6 dimensions that you'll hear about shortly. Those are what we all believe to kind of feed into a healthy work environment and are the focus of not only the work that we do, but the programs and implementation that we offer. I'll turn it over to Andrew.
Hello, thank you. So the work of Engage is grounded in the 6 dimensions that you see here that lead to a healthy and safe work environment for emergency departments. Each dimension includes the tools and skills that support this work environment. We use this framework during on-site assessments and as we develop it, programs for each department. Rachel is going to talk more about these programs and how they connect to these dimensions soon. The next part is how do we support or who do we support? And so really Engage is focused specifically on emergency departments and improving that work environment and including everyone in the emergency care team. The assessment and program incorporates all members of the team and regardless of their role or what they play or do in the work. And the support of ED leadership teams, ED leaders, nurses, hospital leadership team, and members are vital to the success of these programs.
Okay, so I have a question for you to consider. I'd like each of you to take a moment and think about this. How many of you believe that when staff are well, patient care actually gets better? Like happy staff equals happy patients, if you will. All right, do you know your answer? Well, if your answer is yes, you're right. A growing body of research over the last 5 years or so demonstrates that a healthy work environment has a clear impact on patient outcomes. Just a few of the outcomes that have been studied are ICU admissions, overall morbidity and mortality, quality and safety of patient care, and incidence of medical errors. Here at Engage, we believe that the first step in providing the best care is making an investment in your staff and in the health of your work environment. When you invest in your team, you see a myriad of benefits, just a few of which are shown here on the screen. Your staff retention, engagement, and satisfaction improves. Your leaders are able to grow personally and professionally to maximize their impact. And the enriched team culture leads to an overall improvement in the quality of patient care that the team delivers. So Andrew mentioned earlier that we support the entire team, and we do that across our 6 dimensions of healthy work environments. So I want to take a little time to share more about what that looks like. While we do see some challenges that seem universal to all EDs, we recognize that each department has areas where they're doing quite well and other areas where they may need extra support. So we offer programming that is specifically targeted to make the most impact for each department. In all examples, we work with your staff and leaders to build internal capacity so that we create lasting change. We all believe in the importance of staff development and shared governance, and we can provide help with launching or delivering a wide variety of educational programs. For example, we can deliver instructor-led ESI triage education. We can help you and your team get ENPC or TNCC classes started. Or we can facilitate ED-specific training for nurses who are new to our specialty, just to name a few. We also support the growth and development of nurse leaders at all levels, from charge nurses to supervisors, managers, and even director-level leaders. We offer leaders education, mentorship, and coaching for interpersonal skills like crucial conversations and accountability. We can help them build knowledge of business practices and even help with self-reflection and goal setting to promote the personal growth of all leaders. We also offer support for clinical inquiry. We can help you with facilitating a quality or process improvement project. We can offer mentorship for launching an evidence-based practice initiative. And we can even provide consultation for research proposal development. Again, these are just a few examples of how Engage partners with you and your team to strengthen the health of your work environment. We are always excited to get to know each new department we work with and to work together to identify and tackle even your most unique challenges.
Thank you, Andrew and Rachel. So now we will share with you a little bit about what the roadmap to success looks like when you partner with Engage. That begins with an initial discussion. That discussion allows our team to meet your team and to hear from you about your specific challenges within your department and what your goals are, what you're looking to achieve. Step 2 is a stakeholder review. So your senior leaders, the rest of your team, your charge nurses, whichever ones are really involved, need to be involved in this upfront for the most success in the end. And so everybody is truly on the same page and pointed in the right direction in terms of the work in front of us. We will then work to plan an on-site visit. That on-site visit really is a time for our team to hear from your staff. And we spend that entire visit at the bedside, listening to your team, hearing from them about what goes really well in their day and where are their opportunities. This allows staff to feel heard and that their voice matters, but it also helps us piece together where are the key opportunities. And so that we can then, as you see in step 5, plan that co-creation with the leadership team. We want to be able to not only help with your specific needs, but make sure that those are in alignment with the department goals, with your team's goals, so that we can help be as successful as we can. And then implementation. Typically, these partnerships last 6 to 12 months at minimum, but 12 plus months really for kind of full success and culture change. You can see this doesn't happen overnight. This is truly a journey for departments and one that takes time and some patience to really implement in a successful way. So over the past year and a half, Engage has focused on making an impact. You can see here over 5,000 nurse interactions, whether that be in person, through the courses, online. We are really looking to interact with and connect with as many emergency nurses as possible. During that time, we've also interviewed over 750 staff working in the departments that we have connected with. You'll see blue dots on the map here of the United States. Some of those dots are larger. That just means we have more departments in that particular area, but over 25 EDs in that year and a half timeframe. We are looking to continue to grow that impact, continue to meet and connect with emergency departments all over the country. And So this is only the start, but yet very exciting to see unfold. Okay, so we do have some questions and we'd like to get those answered. Our team will go around and respond to those, and our Engage team will read out the questions.
Perfect. So the first question that I have is, does Engage work directly with staff or just with leaders?
Sure, so I'm happy to start. The answer is both. So our work, while specific to leaders, there are components that are specific to leaders, but also work directly with bedside staff. What we understand is that that takes a true partnership between the leaders and the team to be able to be successful. And so ultimately, the staff are providing the direct care, want that work to be relevant and beneficial to their practice, and at the same time, support the leaders in implementing and executing the work.
I have another question. What types of hospitals or EDs do you work with?
I can take that one. We work with all kinds of emergency departments, and we actually have clients that we've partnered with, some that are small rural community hospitals, some that are regional medical centers, and some that are large university or teaching hospitals. So we work with any department that needs our services. And when we go into each department, we do, like we described, a very individualized assessment of what is going well in that department and what areas are opportunities for growth. So we develop programs that are tailored to the specific needs of that department. Some of that is impacted by the type of department and the size of the department that we're working with. But again, it's always an individualized assessment with programs developed specifically to meet the needs that we identify in that department.
Thanks, Rachel. Just a follow-up question to that. Do all EDs need the same programs?
Yeah, and I'll just add to that since we were on that vein. No, not all EDs need the same programs. We do have some that we find become more universally needed than others. But again, that individualized, targeted approach is how we approach each client. We want to make sure that we're meeting the specific needs of each department. And so the programming that's offered after our on-site is specific to where we've identified opportunities.
Thank you. I have another question. Do you address workplace violence mitigation strategies?
Sure, I can take that one. So yes, we do evaluations around workplace violence and those mitigation strategies. We partner with the staff and leadership team to come in and do those type of assessments and really look at the current work environment, where experience happened in the past, and then opportunities for future using best practices that we've connected. But that's very important to the discussion earlier around our dimensions, and part of one of the 6 dimensions is around staff well-being and safety.
Thanks, Andrew. I have another question. Can Engage help me develop an action plan for my engagement survey results?
Well, I'll take that one. So yeah, so Engage does connect with the team at as part of the champion group, and as part of also the work that we do with the leadership team to learn a little bit about what surveys are currently being used at the departments, and then using those surveys to kind of continue the work and move the needle around engagement. So we'll partner with everybody so that we're using the same tool that's already been used there to help kind of with those action plans that are co-created, as Jen was talking about.
All right, I have 2 more questions. One being, I have a lot of new nurses in my ED. What programs do you offer to help bridge the gap after orientation?
I'm happy to answer that one. So the time after orientation is actually a really key time in terms of retention for nurses. So ENA offers the ENA residency program. It is a great program for entry into practice, new to ED nurses, and really helps set the foundation for what they need to know and how they can be successful. What we are now recognizing and have really a program to address is after orientation, through that 1 to 2 year timeframe, when they are still considered in the novice phase of their career, but yet really are working independently. And so how do we support them, one, to feel confident in their clinical skills, and two, to feel like they have a sense of camaraderie and a cohort essentially to work with. So we will take a group of nurses within this time frame and work with them throughout a period of time to be able to fine-tune clinical skills, increase the critical thinking skill set, and do that with their own colleagues so that they learn from one another and can build their confidence in emergency nursing.
The next and final question that we have is, how have other EDs been able to get this work paid for?
So we have been relieved to find that healthcare systems are beginning to recognize the value of investing in the workforce, especially when advocacy is done around that. We are able to work with clients to help spread out the costs of working with us over various budget cycles, or to think about creative ways to use different budget line items to fund some of the work. For example, some of our education programs, some departments have been able to pull from education budget money to support a portion of the work that we do. And by bringing various budget cycles and or budget pockets together, they're able to get funding to cover the entirety of the work. Other opportunities exist in some markets for philanthropic funding. We have some clients who have donors in their area that offer philanthropic funding for healthcare efforts. And again, when the case is made for the importance of the healthy work environment, those philanthropic funds are accessible for this work. Finally, some health systems do have internal giving campaigns that support foundation funding for nursing excellence, nurse well-being, or just nursing in general. And so that's another great source to look at, whether there are foundations locally that hospital staff are able to apply for funding sources. So lots of different ways where this work can be funded, and we just look forward to working together to help you identify what options are available in your area.
Thank you so much, Rachel. That is actually the end of the questions that we had.
Great. Thank you very much. And thank you to all who submitted questions. We appreciate that. So now I'd like to take a minute just to introduce the next topic for the August webinar, which will be held on August 14th, 3 p.m. Eastern Time. And we'll focus on meaningful recognition and recognition strategies for a high-performing emergency department. We will have a panel of guests from a variety of different roles, leadership, staff, charge nurse, just to be able to explain not only their strategies and what they have found successful, but how they've experienced other strategies implemented and methods for recognition that they have encountered in their career. So really looking forward to that discussion with them in a month. And lastly, thank you again for your participation today. We appreciate your participation here. There is 2 QR codes here for you. One is a free survey tool. That's the QR code on the right. That one will lead you to a survey that you can use for your department. It'll give you at least a quick gauge on where your department stands, where there may be opportunities overall that are related to your healthy work environment. And the left is to book a consultation or even have a longer discussion with us about what opportunities may exist and how we could be able to support you in that work. So again, thank you for joining today. We appreciate it and look forward to seeing you at the future webinars.